Hi, my name is Gabrielle. I'm a clinical exercise physiologist here in the cardiac rehab department. Today I'm going to show you a resistance training workout that you can incorporate into your routine 2 to 3 times a week. It is important to note that cardiac or aerobic exercise is fundamentally the most important cornerstone of any exercise plan. However, resistance training programs can provide extra cardiovascular benefit when incorporated into your routine in addition to aerobic exercise. Any of the exercises that we do today do not need extra equipment. You can use body weight, you can use dumbbells. In addition, you can also use water bottles and cans at home if you have those accessible to you. The first exercise that we're going to do here today is a squat. I do have a modified version of the squat, and I'll show you how to do the chair sit to stand next after I show you this squat. So in order to perform a proper squat, we want to put our feet shoulder width apart. We want to make sure that our chest remains upright throughout the movement and that we're sitting back in our hips as we squat down. We want to make sure in addition that our knees are not going over our toes too much. And that's about it. So let's go ahead and do one together as practice. So we're going to go ahead and sit back in our hips, feet are shoulder width apart, our chest remains up, and then we're going to go ahead and squat back up. Let's go ahead and do 10 of those together. 1, 2. We're also making sure that we're having controlled breathing throughout this movement. So as I squat back up, we're making sure that we're breathing out, and as we squat down, we're breathing in. So let's do some breathing exercises together. We're going to breathe in and out, in and out, in and out. If a squat is too difficult for you, you can go ahead and do a chair squat, and I will show you how to do that. We're going to go ahead and put our feet shoulder width apart. We're going to sit our hips back into the chair, and then we're going to stand up from the chair, like so. We're going to go ahead and do 10 squats together now. And 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great. It's also important to note that while you're doing these exercises, we want to make sure that we are breathing consistently throughout the movements. So the next exercise that we're going to do is a dumbbell lateral raise. Again, if dumbbells are too much, you can just use your arms or any other equipment that you have at home. To do a dumbbell lateral raise, we're going to put our hands and arms in front of us, and then we're going to raise them laterally to the side in line with our shoulders and back down. And 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. So the next exercise that we're going to do are step-ups. If step-ups are too difficult, you can go ahead and just do seated knee raises, which I will show you how to do. So in order to do a step-up, you're going to place your foot in the center of the step. You can use a step at home or a step at the gym. Either suffices. You're going to go ahead and place your foot in the middle of the step, and you're going to step up and step back down, and you're going to do 10 on each leg. Let's go ahead and do them together. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You're going to want to go ahead and switch to the other leg once you finish doing 10 reps on that leg. If step-ups are something that you don't think is suitable for you, you can go ahead and sit in your chair and we can do knee raises instead. So what we're going to do is we're going to lift one knee up, place it back on the floor, lift the other knee up and place it back on the floor. We're going to do a total of 10 for each leg. Let's go ahead and start. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Go ahead and switch to the other leg. The next exercise that we're going to do is a bicep curl. In order to perform a bicep curl, you're going to want to hold your weights in the center of your palm with your palms facing forward. You're then going to want to curl your weights towards your shoulders and back down. Let's go ahead and do 10 together. 1, 2, 3, 4, 5, 6, 7, 8, 2 more, 9, last one, and 10. Good work. All right, so the next exercise that we're gonna do is a modified wall push-up. In order to perform a modified wall push-up, you're gonna wanna stand with your feet about shoulder width apart. Your body is gonna be inclined to the wall with your hands in front of you on the wall. You're then gonna wanna bend your elbows in a 45-degree angle with your nose almost touching the wall. You're then going to want to push back into your beginning position. Let's go ahead and do 10 of these together. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. As you start to get stronger at this movement, you can start to incline your body further away from the wall, which will make the movement more difficult for you. All right, if a wall push-up is too easy for you, you can start to progress yourself to a push-up that's closer to a floor push-up. In order to do that, we can use a bench or a chair. You're gonna wanna put your hands onto the surface, incline your body away, and push up onto that inclined surface. 3, 4, 5. So the next movement that we're going to perform together is a glute bridge. This is great for core work, great for your back, and great for your glutes. In order to perform a glute bridge, you're going to want to get on a flat surface such as the ground. You're going to lie down with your feet firmly planted on the ground, knees are bent, arms are next to your side. You're then going to want to raise your hips up so that they are in line with your knees, your hips, and your chest is all one straight line. And then you're going to lower your hips back to the ground. Let's go ahead and do 10 of these together. Raising the hips up towards and back down. Raise the hips back up and back down. That's 2 of them. 3, 4, 5. Notice how we're holding each movement for about 3 seconds. 7, 8, 2 more, 9, last one, and 10. The last exercise that we're going to do here today is a bent over row. We're going to do this in a seated position. So in order to perform this exercise, we're going to sit down on a chair and we're going to hinge forward at the hips. Our arms are down by our side, and we want to focus on driving the elbows back while also squeezing our shoulder blades together. And then we're going to lower the weight slowly down by our side. Let's go ahead and do 10 of these exercises. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's important to note that we want to make sure that our back remains nice and straight and neutral, that we're engaging the core, and that we're also squeezing those shoulder blades together. Thank you so much for joining me in on that workout. A couple really important things to know is that while we're performing these exercises, we want to focus on maintaining nice controlled breathing. Breathing in through our nose and out through our mouth while we're performing each movement. In addition, we want to make sure that we're also performing each exercise nice and controlled, that we're not rushing through the movements, and that we're getting a full contraction with each exercise that we're doing by going through a full range of motion. Again, if any of these exercises are too difficult, if they are causing any discomfort, you can skip past them or do the modified version of that exercise that I showed in the video.